Good morning. Today is day 36 and one more day on my journey, and I thank you for joining me one more time. I will bring you up to date. My nurse navigator did her job, and I now have my appointments 15 minutes apart. So I've got a 9:45 and a 10 o'clock, so I should be able to be in there by 9:30 and out by 12:30, I hope, and on Mondays anyway. So I'm thrilled. She was right on top of it. Within half an hour, she had it taken care of. So that was a good thing. Well, today I'm going to talk to you about something I really don't want to talk about, and I've been putting it aside and wondering how I should do this and should I even do this, but I'm going to do it because you're on this journey. You need to hear this too. I'm going to talk specifically about the side effects of radiation. And I heard this twice with the radiation oncologist, and she sent me home with a piece of paper with all this written down so I could actually look it over, really understand it, et cetera, et cetera. Plus, I got a piece of paper that tells me about how to take care of my skin during this whole radiation process. So the first thing is you need to keep your skin clean and dry, of course. And they want you to use gentle soap and warm water, but not hot or anything like that. And without fragrances, which I already do, so thank God for that. They want you not to rub, scratch, massage any of the skin in that area. When you take a shower, they want you to pat it dry. So this is going to be a whole new experience. They also want you to wear only clothes that is very soft against that. So I've kind of got most of that stuff in place and kind of figured it out for myself. And so I feel pretty confident about that. And if you have any issues, your skin is getting, kind of beat up or whatever, they want you to talk to your team about that right away so that they can help you. They give you, right off the bat, they give you creams that help with any skin damage whatsoever, the dryness, the itchiness, whatever kind of reactions take place. So anyway, that's the good news. They really got a lot of stuff in place for you as you begin this journey into the therapy part of it. The whole point, remember now, the whole point of this is they are trying to kill off the cancer 100%, that it's just going to be scar tissue. Sounds good to me. I love that whole concept. Don't know if it'll happen, but I'm up for it. That's for sure. So these are some of the immediate reactions that you might get as you begin. The first one is fatigue, and that's the most common, I think, of anything. I can remember that when I had radiation after my breast cancer. At that time, I had mammocyte radiation, which is they go inside the breast and do the radiation from inside. And so I went twice a day for 10 days. And I can remember going in the morning, coming home, napping, going in again at 4 in the afternoon, coming home, and probably going almost right to bed and sleeping the night and starting the day the next day. So that was kind of how it went. They tell me that the fatigue really doesn't set in for maybe a couple of weeks. So I got a couple of weeks before that starts, which is great. There's also skin reddening and irritation, which you kind of expect. The other thing that could happen is coughing/wheezing. I've got a little wheezing once in a while if I sit like crunched, I don't know, like really crunched up, I don't know. I have a little wheezing in my chest, I can hear it. And sometimes because this is so close to your esophagus, you might have swallowing difficulties. In other words, you might have pain swallowing, okay? And of course, decreased blood cell count. So those are kind of immediate common reactions. An uncommon reaction would be inflammation of the lung. Got to look at that anyway. And very rare would be nausea. Probably get nausea from the chemotherapy, but not from the radiation. So then there's also the long-term reactions, and this gets a little tough, I think. This is the ugly part. not that it's ever going to happen. One of the things I just want to say is that when I don't want you to take this away from me. This is really important. I need to look at this. I need to really digest this information, because down the road, if something really happens, I need to be aware of what I'm looking for. So this is very important to me. You know, like we have a tendency, and I do too, of taking things away. You know, like, you know, when a child hurts themselves, you pick them up and you go, it's okay, it's okay, it's okay. And we do this to adults too. It's going to be okay. It's not going to be as bad as you think. Well, let me think it's going to be as bad as I think it might be. And that way I can get on with my life, because I've faced it, I've stared it down, and I'm ready to move on, and I can put it aside. Done with it, okay? So these are some long-term reactions. Some common things are scarring of the lung, which does not require treatment. Shortness of breath could be another one. Dryness of the skin in the area of treatment. Uncommon would be scarring or inflammation of the lung requiring treatment. Inflammation of the heart would be another uncommon one. And another uncommon one would be permanent skin darkening. Rare would be inflammation of the muscle of the chest wall, or swallowing difficulties requiring surgery. And then there's the extremely rare ones, which you don't even think about. Heart attack, woo, nerve damage, spinal cord injury, fatal scarring or inflammation of the lung, tumors caused by radiation, secondary malignancy. That's pretty rare. That's like if somebody's really young. Not so much when you're 80, you don't worry about that. So that's kind of nice. So that's what I'm kind of looking at and facing into, and I think I've done that now, and that's why I'm able to share this with you. Meanwhile, one of the questions that I get a lot is, how is Harry doing? And I always say, well, he's doing really good. He's doing fine, actually. And he is. I think that one of his major concerns when I first started with this whole process was he was concerned that I would not be honest with him. You know, that I wouldn't tell him how bad it was or what I was having to go through or that kind of thing. And he's found out that that is not what happens with me. I tell him I'm really upfront, I'm really honest. And when I do these YouTube postings, we also watch those. I watch them with him, later on. And every time that I come on and I'm talking about what I'm going through or whatever, he gets teary-eyed. And he is so important in my life. This year we actually celebrate, I can't even think of the word, we celebrate 60 years, which is amazing. It's in just a few weeks. And one of the gifts that Harry has always given me is he's made me feel precious. And when he gets teary-eyed watching my postings, it does that all over again, because he's so emotionally in touch with me. Not only are we're just have been best of friends for 60 years, and I'm always grateful for that. So today I challenge you to just really think about your best friends and who they are and what they give you, because it's such a precious gift that they give you. And I'm not going to post over the weekend. But I will start again next week. Next week I have a few things happening, and I will keep you up to date. And the first thing that happens is on Monday, I have an education class for the chemotherapy part of it. So that will be very interesting to me. So talk to you soon, and have a great weekend. Bye.